When I was a medical student, I knew I wanted to do something with my hands. I knew I wanted to do something procedural. I also knew I really wanted to do something that also had long-term follow-up and care for patients. In urology, you have that ability to both see patients urgently for emergent or time-sensitive operations, but also to follow them long-term. And in my case, kidney stones, you get to follow patients for a very long time for stone prevention as well as further treatment. Typically, when I see a new patient, they haven't had a new diagnosis of a kidney stone, usually with an imaging test in the ER, or they've had a long-standing history and are looking either for a second opinion or for a change in the way that their kidney stones are being managed. When I first meet you, that's what I'm looking for. How do you feel? Do you have pain? Are you symptomatic? How long has this been going on for? Then we look at the imaging and decide, is this a stone that could be treated surgically, or is this something that you could live with for a little bit longer, and then we decide to treat it later. Seeing patients after having done a surgery and being able to work with them to prevent future stone episodes is incredibly rewarding. I have a lot of pride in how I approach surgeries and the outcomes that I can create, but more so it's about preventing a patient from having to go through that experience again. If you are a kidney stone former, you have a high risk of forming stones again, and that's when we really start to get into the prevention side of things within the Department of Urology, but also with our colleagues in nephrology who are the kidney doctors. We usually work together, and sometimes even with nutritionists, to really develop a program that helps an individual prevent kidney stones. In the spare time, it's spending time with my husband, who is also a urologist, trying to be outside as much as possible, learning to cook more, and just trying to regain seeing friends and family.